What if the most common mistakes in male masturbation was silently sabotaging not just pleasure, but long-term sexual health? It's a topic often shrouded in secrecy, but one that deserves an honest spotlight. For many men, masturbation is a private ritual surrounded by myths and shaped by cultural taboos. Yet, understanding what goes wrong and how to do it right can transform not only personal satisfaction but overall well-being. I'm Dr. Isabel Lopez, a urologist with over 25 years of experience. And where are you watching from? Drop it in the comments, and stick around because I have a surprise for you at the end. Today, we're breaking down the 10 most frequent mistakes men make when it comes to masturbation, and how to sidestep them for better health, satisfaction, and confidence. Masturbation is a natural part of male sexuality, but misinformation and stigma lead many to adopt habits that do more harm than good. This video isn't about judgment or shame. It's about education, empowerment, and practical advice. Whether you're curious, concerned, or simply looking to improve your self-care routine, you're in the right place. We'll separate fact from fiction, tackle the science, and offer actionable tips to build healthier habits. Along the way, expect clear explanations, examples you can relate to, and a no-nonsense approach. Our goal? To create a safe, respectful space for open conversation about one of the most universal yet misunderstood aspects of male sexuality. Ready to rethink what you thought you knew? Follow the channel and let's dive into the truths, the traps, and the transformative power of informed self-pleasure. In the next segment, we'll pull back the curtain on the myths versus facts that surround male masturbation and why the difference matters more than you think. For centuries, male masturbation has been surrounded by rumors, taboos, and conflicting advice, often leaving men confused about what's true and what's simply outdated folklore. Across different cultures and historical periods, attitudes have shifted from outright condemnation to silent acceptance, shaping beliefs that still echo today. Many men internalize these messages without ever questioning their accuracy or relevance in modern times. One of the most persistent myths claims that masturbation causes physical weakness, hair loss, or even infertility. These ideas, rooted in old superstitions and moral anxieties, have little basis in science. Another common misconception is that masturbation signals loneliness or emotional deficiency, which often leads to unnecessary guilt and shame. Breaking free from these beliefs is essential for a healthier relationship with one's own sexuality. Scientific research paints a very different picture. Studies consistently show that masturbation is a normal and often beneficial part of male sexual health, helping to relieve stress, promote better sleep, and even support prostate function. It's not linked to any major physical harm when practiced in moderation and with safe techniques. More importantly, it offers men an opportunity to understand their own bodies without external pressure or expectations. Yet, the influence of persistent myths can't be underestimated. Many men hesitate to seek information or talk openly about their experiences, which can reinforce cycles of secrecy and self-doubt. Understanding the facts empowers individuals to make informed choices and build habits that truly support their well-being. Education becomes the antidote to both confusion and anxiety. To further break the silence, this video will present real-life examples and scenarios that highlight the difference between myth-driven behaviors and evidence-based self-care. By recognizing and rejecting outdated ideas, men can cultivate a more positive and proactive approach to their sexual health. Remember, every step toward knowledge is a step away from shame. The journey continues. Up next, we'll tackle the first major mistake, over-reliance on pornography and how it can reshape expectations, intimacy, and even the way the brain responds to pleasure. In today's hyperconnected world, access to explicit content is just a tap away, making it easy for many men to turn to pornography as a regular part of their masturbation routine. While it may seem harmless on the surface, over-reliance on porn can gradually reshape not just sexual expectations, but also how the brain processes arousal and pleasure. This often occurs without conscious awareness, subtly shifting the landscape of personal intimacy. Pornography presents an edited, exaggerated version of intimacy, one that rarely reflects real-life connection or genuine emotion. As a result, men who depend heavily on such content may begin to equate arousal with unrealistic scenarios, overlooking the importance of mutual touch, communication, and authentic desire. The distinction between fantasy and reality blurs, sometimes leading to dissatisfaction with both oneself and potential partners. Over time, frequent use of porn can alter neural pathways associated with pleasure and reward. The brain, seeking the same heightened stimulus, may respond less intensely to everyday intimacy, which can foster frustration or detachment. This isn't about demonizing pornography, but about understanding its powerful influence when used excessively. Recognizing these patterns is the first step toward regaining balance. It's essential to differentiate between occasional use and dependency. If porn becomes the sole avenue for sexual satisfaction, or if real-life experiences no longer provide the same fulfillment, it may be time to reassess habits. Reflection and honest self-assessment help determine whether this reliance is enhancing or hindering personal and relational well-being. Even small changes, like exploring new sources of arousal or practicing mindfulness, can make a significant difference. Visual cues can serve as reminders, setting aside time to connect with oneself without screens, or creating a more sensory-rich environment. These strategies break habitual cycles and invite more presence into the moment. The goal is not restriction, but a healthier, more conscious relationship with one's own sexuality. Next, we'll address another widespread concern: the frequency and compulsivity of masturbation. How much is too much, and when does a habit become a problem? The answers may surprise you. The question, how much is too much, is one of the most common when it comes to male masturbation, yet the answer is far from one size fits all. Frequency alone isn't the best indicator of a problem. What truly matters is how the behavior fits into daily life and whether it begins to disrupt personal well-being. For some, occasional self-pleasure is a stress reliever, while for others, it can become an escape from unresolved emotions or life pressures. Compulsive masturbation is characterized by a sense of loss of control, where the urge to engage overrides other priorities, relationships, or responsibilities. It can manifest as persistent thoughts about masturbation, failed attempts to cut back, or continued behavior despite negative consequences. This pattern may impact work productivity, social interactions, or even lead to neglect of personal goals and routines. Recognizing these signs early is crucial. Rather than focusing solely on numbers, individuals are encouraged to pay attention to context and motivation. Is masturbation being used to cope with boredom, anxiety, or loneliness? Does it interfere with sleep, commitments, or personal growth? Honest answers to these questions shed light on whether a healthy habit is turning into a problematic cycle. It's important to remember that sexual expression is deeply personal. Comparing oneself to others, whether through friends, forums, or online content, rarely provides clarity. The real measure is how one feels physically and emotionally after the act, and whether it enhances or detracts from overall quality of life. Addressing compulsivity means reclaiming agency over one's choices, not imposing unnecessary guilt. Simple strategies, like setting intentional boundaries or redirecting energy toward other fulfilling activities, can help restore balance. Mindfulness, journaling, or seeking support from trusted individuals are practical tools for gaining perspective and making empowered decisions. Self-awareness, rather than self-criticism, is the foundation for lasting change. Up next, let's shift focus to another often overlooked area: the role of physical health and hygiene in safe masturbation. Poor habits in this area can lead to preventable problems, and the solutions are simpler than most people think. One of the most underestimated aspects of male masturbation is the role that physical health and hygiene play in both comfort and safety. Many overlook the basics, thinking that self-pleasure carries little risk. In reality, poor hygiene can lead to a range of preventable issues, from minor skin irritation to more serious infections. These problems are easily avoided with a bit of routine care and awareness. Cleanliness is essential before and after any intimate act, including masturbation. Hands should be thoroughly washed, as bacteria and dirt can transfer easily to sensitive skin. For uncircumcised men, gentle cleaning under the foreskin is especially important to prevent the buildup of smegma, which can cause discomfort and odor. Even the choice of lubricant matters. Using non-irritating, body-safe products reduces the risk of allergic reactions and microterms. It's not just about washing, though. Safe practices include being mindful of the tools and objects involved. Improvised items, such as household lotions or unsanitary objects, may introduce unwanted chemicals or germs. Instead, stick to products specifically designed for intimate use. If sex toys are involved, they should be cleaned with antibacterial soap and warm water before and after each use, following the manufacturer's instructions for best results. Ignoring minor irritations or injuries can quickly escalate into bigger health problems. Redness, swelling, or persistent discomfort are signals that something isn't right. Treating these early and taking breaks when needed helps maintain skin integrity and overall comfort. If symptoms persist, consulting a healthcare professional ensures appropriate care and peace of mind. Visual reminders, like keeping hygiene products easily accessible in the bathroom or bedside table, support the creation of healthy habits. Establishing a simple routine, wash, pleasure, clean up, keeps the process straightforward and minimizes the risk of complications. The goal is to make self-care second nature, not a chore. Next, we'll explore the often unseen side of the equation, the emotional and psychological dimensions of masturbation. How do feelings of guilt, shame, or anxiety impact well-being? And what are the keys to a healthier mindset? While physical health is crucial, the emotional and psychological side of masturbation often receives far less attention. Many men experience lingering feelings of guilt, shame, or anxiety, shaped by cultural, religious, or familial messages received over a lifetime. These emotions can quietly undermine self-esteem and hinder the ability to enjoy a healthy relationship with one's own sexuality. It's a silent struggle for many, often endured alone. Society's mixed signals about masturbation, sometimes treating it as normal, sometimes as taboo, fuel confusion and self-doubt. Men may question whether their habits are normal or worry that private pleasure reflects poorly on their character. This internalized conflict can cause unnecessary stress, making it harder to separate fact from fiction. A healthy approach starts with compassion and honest self-reflection, not criticism. It's important to acknowledge that pleasure and self-exploration are natural aspects of human experience. Reframing masturbation as a form of self-care rather than a source of embarrassment is the first step toward emotional well-being. Understanding that everyone's journey is unique and that occasional ups and downs are normal provides much-needed relief from self-imposed pressure. When negative feelings persist or begin to interfere with daily life, seeking help is a sign of strength, not weakness. Professional support, whether from a therapist, counselor, or sexual health specialist, can offer practical tools and a safe space to explore deeper concerns. Open conversations with trusted partners or friends also help normalize the topic and break the cycle of secrecy. Visual cues in daily life, like positive affirmations or reminders to check in with one's emotions, can interrupt patterns of shame and encourage self-acceptance. Mindfulness practices, journaling, or guided meditation may also assist in processing complex feelings. These small steps build resilience and foster a more balanced outlook on sexuality. Join the Members Club and leave a super like to support open, judgment-free conversations like this one. Coming up, we'll shift focus to the physical side again, specifically the dangers of unsafe techniques and tools, and how to stay safe while exploring new sensations. In the quest for novelty or heightened pleasure, some men resort to techniques or tools that may seem harmless but can cause real harm over time. Using excessive pressure, vigorous movements, or unfamiliar objects increases the risk of skin abrasions, bruising, or even more severe injuries. Most injuries are avoidable with a bit of foresight and an understanding of what is truly safe for the body. One common unsafe practice is using improvised items not designed for intimate contact, household lotions, makeshift toys, or even rough fabrics. These can introduce chemicals, allergens, or bacteria, leading to infections or allergic reactions. It's always safer to use lubricants and toys specifically created for sexual wellness, as these products are tested for safety and comfort. Another risk involves repetitive use of the same technique or grip, which can desensitize nerve endings or lead to conditions like death grip syndrome, where normal touch no longer brings pleasure. Alternating pressure, speed, and rhythm can help maintain sensitivity and keep experiences enjoyable over time. Listening to one's body and pausing if any pain or numbness occurs is a simple yet often overlooked safeguard. Injuries sometimes go unnoticed until they interfere with daily activities, such as urination or normal sexual function. Prompt attention to discomfort, swelling, or discoloration is important. Never ignore persistent symptoms. In some cases, a break from masturbation is all that's needed for full recovery, but if issues persist, a healthcare professional should be consulted. Practical safety can also mean keeping hygiene in mind, washing hands and toys before and after use, choosing body-safe lubricants, and ensuring a relaxed, private environment. These steps not only reduce the risk of harm but also contribute to a more pleasurable, mindful experience overall. Prevention is always easier than treatment. Next, we'll address another hidden pitfall: failing to truly understand one's own body. Lack of sexual self-education can limit pleasure and even hinder intimate relationships. How can curiosity and learning reshape the experience? A surprising number of men go through life without ever truly exploring or understanding their own bodies. This lack of sexual self-education often stems from embarrassment, lack of information, or simply not knowing where to start. Yet, curiosity and intentional learning are powerful tools for enhancing both pleasure and confidence. Every body is unique, and what feels good can change with time, health, and experience. Many settle into routines, using the same technique or speed each time, without considering how slight variations might offer new sensations. Taking time to explore different rhythms, pressure, or even hand positions can uncover preferences previously unnoticed. This self-discovery doesn't just improve solo experiences, it can also translate into clearer communication and deeper intimacy with a partner. Learning about anatomy, arousal patterns, and safe practices is a form of self-respect. Resources are more available than ever, from reputable websites to books and even professional guidance. By seeking out accurate information, men empower themselves to make healthier, more satisfying choices. Knowledge dispels myths and makes room for growth. Communicating preferences is an essential skill in intimate relationships. When men understand their own responses, they are better equipped to express needs, boundaries, and desires to a partner. This creates a foundation for trust and mutual satisfaction, reducing anxiety or misunderstanding in shared experiences. Self-education becomes an investment in both solo and partnered pleasure. Even small steps count: trying a new lubricant, experimenting with different times of day, or simply paying attention to the body's feedback. Keeping an open mind and a sense of curiosity invites continuous learning and adaptation. Growth in this area isn't about reaching perfection. It's about building comfort and confidence. Join the Members Club. Drop a super like, follow the channel, and leave a comment if you're ready to turn learning into action. Up next, we'll explore the tangible benefits of healthy masturbation, physically, emotionally, and within relationships. There's more value than most people realize. When approached mindfully and with self-awareness, masturbation becomes far more than a source of physical pleasure. It's a practice that supports overall health and well-being. Scientific studies consistently highlight its positive impact, not only on stress reduction but also on emotional balance, sleep quality, and even immune function. For many men, it serves as a practical form of self-care, helping to release tension and restore calm after a busy day. Emotionally, healthy masturbation fosters a sense of self-acceptance and confidence. By tuning into one's body, men can better understand their desires, boundaries, and responses. This awareness can reduce anxiety, increase self-esteem, and promote a healthier relationship with sexuality as a whole. For those navigating periods of stress or uncertainty, it becomes a safe, private way to reconnect with oneself. Psychologically, masturbation has been shown to help regulate mood, alleviate symptoms of mild depression, and provide a constructive outlet for natural urges. It's not a cure-all, but it can play a valuable role in mental health routines, particularly when paired with other healthy habits. Open dialogue about these benefits is essential to dismantling lingering stigma and encouraging positive attitudes. In relationships, healthy masturbation can enhance intimacy rather than detract from it. Partners who understand and communicate their own needs are more likely to enjoy fulfilling connections. It can also alleviate pressure or performance anxiety, allowing both individuals to explore at their own pace. Sharing knowledge and experiences in a trusting environment only deepens the bond. For men concerned about sexual health, regular self-pleasure, practiced safely, can support prostate function, promote blood flow, and even help identify changes that may warrant medical attention. Routine check-ins with one's own body become a form of proactive health management, benefiting long-term wellness. In our final segment, we'll recap the most important points and share resources for those who want to learn more. Stay tuned, because understanding is just the beginning. The real transformation happens when you apply what you've learned. Wrapping up, it's clear that male masturbation is a topic surrounded by myths, misunderstandings, and unnecessary shame. By identifying and avoiding the most common mistakes, from over-reliance on pornography to neglecting physical and emotional health, men can turn this private act into a source of well-being and self-empowerment. Each insight shared today offers a path toward healthier habits, greater self-awareness, and improved quality of life. It's important to remember that there's no universal standard. Every individual's experience is unique. The key is to listen to your body, embrace curiosity, and stay open to learning. Masturbation, when practiced with care and respect, supports both physical and emotional health, contributes to relationship satisfaction, and can even serve as a valuable tool for self-care. If you find yourself struggling with guilt, compulsivity, or confusion, know that support is available. Open dialogue with trusted professionals or peers helps break the cycle of secrecy and promotes a culture of acceptance. Educating yourself with reputable sources ensures you're making choices that serve your well-being, not someone else's expectations. This conversation doesn't end here. There's always more to discover. Check out the recommended resources in the video description for further reading and guidance on safe, fulfilling sexual health. Consider joining online forums or support groups dedicated to men's wellness, where open discussion is encouraged and respected. Join the Members Club. Drop a super like, follow the channel, and leave a comment sharing your thoughts or experiences. Your participation helps normalize this important conversation and supports others on their own journeys. Remember, growth starts with honesty and self-compassion. And for those who stayed to the end, here's your surprise. Next week's video will tackle your most requested topic, so leave your suggestions in the comments. Until then, take care of yourself and keep learning.